Hello again to wheat. I've got another article for you. This one is a multidisciplinary approach to increase dysphagia compliance in stroke patients. Dysphagia is always a topic. I get a lot of these articles, way more than I can publish. So I look for something different. In this article, this is a quality improvement project. I also don't usually accept a lot of QI, and I did this one. It was written by 3 nurses and a speech therapist at Sanford, California. And their aim was to look at dysphagia, and specifically they were triggered by some fallouts. Now, fallouts is anytime somebody doesn't meet like every item for stroke, and we talk about stroke fallouts all the time. One of the coolest things about this particular paper is they look at fallouts not as the fault of one person, and I can't tell you how many times we blame the fallout on the nurse. It's a systems error, and that's what they did. They looked at multidisciplinary changes for a multidisciplinary problem. We all know that dysphagia happens. In fact, about 1 out of every 2, 50% of the patients has some difficulty swallowing, about 50%. And if you have dysphagia, outcomes can be worse, and it requires a change in the plan of care. The problem is that they changed the paradigm that most hospitals, when faced with this, it feels like they all go to these 1-hour mandatory online modules. God, I hate them. Nobody likes them, and they don't really make a change. This group looked at a 5-minute education huddle. That's pretty cool. Like, okay, so you're going to come to me, I don't have to go to you, and you're going to give me 5 minutes worth of knowledge. And I really thought that was a pretty cool, different approach. Now, they have 3 years of data, which that's pretty impressive. And looking at their data, there's some graphs in here and stuff. I'm not really sure they fixed the problem yet, but I think they're on to a new way of us to attack QI. I enjoyed this. I think everyone will enjoy reading it.